My clock says 6:30. So we will go ahead and get started this evening. Now is the time and place for a meeting of the Beaverton Planning Commission. For the record, I will do a roll call to verify which commission members are present and participating this evening. We have Commissioner Glenwinkle, Commissioner Lawler, McCann, and Winter. Commissioner Akal is excused and absent, and Commissioner Ellis may be joining us shortly. We'll see. So first up, we have commission communications. Any communication from commissioners? Okay, seeing none, we can move on to staff communication.
Good evening. Anna Slatinsky, Planning Division Manager for the City of Beaverton. I do not have any staff communications tonight.
Okay. Then we have new business. So the first item on the agenda is the application for LU. Sorry, stop for a moment. Welcome, Commissioner Ellis.
Yeah, sorry about that. I had Zoom problems. Thank you.
So the first item on the agenda is the application for LU 32023-00356 CAT Internal Services Building. Case file numbers CUN 32023-00346, CUN 32023-00347, DR 32023-00348, and TP 22023-00351. The applicant has the burden of providing that the applications are consistent with the Beaverton Development Code, Comprehensive Plan, and any applicable Beaverton Code provisions. The criteria that must be addressed in this hearing are Development Code Sections 40.03.1, Facilities Review Committee, 40.15.15.5.c, New Conditional Use, 40.20.15.3.c, Design Review 3, 40.90.15.2.c, Tree Plan 2. Testimony, arguments, and evidence must be directed towards these approval criteria or other criteria in the Comprehensive Plan or Development Code that the speaker believes to apply to the application. Failure to raise an issue accompanied by statements or evidence sufficient to allow the Planning Commission and other interested parties an opportunity to respond to the issue may preclude an appeal to the Land Use Board of Appeals based on that issue. Anyone who submits comments or gives oral testimony has standing to appeal this decision. Failure of the applicant to raise constitutional or other issues relating to the proposed conditions of approval with sufficient specificity to allow the city to respond to the issue may preclude an action for damages in circuit court. State and local law require commissioners to make certain disclosures. To these ends, the following questions will be asked. Does any commissioner have a potential or actual conflict of interest, ex parte contact, or site visits to declare? I will start with Commissioner Ellis.
No to all three.
Hey, Commissioner Glenwinkle.
No to all three.
Commissioner Lawler.
No conflicts or contacts, but I did conduct a site visit today and did not speak with anyone.
Commissioner McCann.
No to all three.
And Commissioner Winter. Oh, you're muted, Commissioner Winter.
No to all three, but I'm very familiar with this location.
Okay, and no to all three for me as well. Does any member of the audience wish to question a commissioner about ex parte contacts or site visits, or challenge the right of the commissioner to participate in this hearing? Okay, let the record show no response. The order of the public hearing tonight will be as follows. The city staff will give a presentation followed by commissioner questions of staff. The applicant will then be given 20 minutes for its presentation, followed by commissioners' questions of the applicant. Then members of the public in support of the application can speak for up to 5 minutes each, followed by members of the public opposed to the application may speak for up to 5 minutes each, and then members of the public who are neither in support nor opposed will then have 5 minutes to speak. After public testimony, the applicant will have 5 minutes for rebuttal. The Planning Commission will then hear any final comments from staff. We will now begin with the staff presentation.
All right. The screen look right? Great. Fantastic. Okay. Greetings, Chair and Commissioners. Aaron Harris, Senior Planner, City of Beaverton Community Development Department. My presentation this evening is for LU3 2023-00356, CAT Intensive Service Building. Land Use Applications CUN3 2023-00346, CUN3 2023-00347, DR3 2023-00348, and TP2 2023-00351. This slide provides a project summary. The applicant proposes to construct a residential care facility to provide drug and alcohol treatment services. The facility is designed to provide 56 beds for residential treatment, 16 beds for detox services, 6 beds for transitioning patients between programs. It also includes outpatient sobering facilities, cooking and dining areas, 2 enclosed private outdoor spaces, and administrative space. This slide outlines the land use applications associated with the project. The proposal includes a Design Review 3 application to convert an existing approximately 24,000 square foot office building and to construct a new 2-story, approximately 16,600 square foot building. Facade changes to the existing building and modifications to existing landscaping and circulation areas are also proposed. 2 new conditional use applications are requested to address the proposed use, as well as the hours of operation. A tree plan 2 is requested to remove 17 community trees, and staff notes that the applicant proposes to plant 46 new trees with development. This slide provides a vicinity map illustrating the site and surrounding area. The subject site is located between Highway 26 and Northwest Cornell Road. The subject site is also located adjacent to the City of Hillsborough boundary, which is seen on this illustration as the blue line. Here's another vicinity map zooming in on the site. The site's located on the east side of Northwest Evergreen Place. It's 2 acres. This slide identifies the existing on-site uses and the uses of the surrounding area. The subject site is an office building. The properties to the north and south of the subject site are office and professional service buildings. The property to the east is undeveloped, and the properties to the west are retail trade and are located in the City of Hillsborough. This slide provides a zoning map of the site and the surrounding area. The subject site is zoned community service, as are the properties to the north, the south, and the east. And the property to the west is in the City of Hillsborough, and it's zoned general commercial. Here is a site plan illustrating the proposed site design. This slide provides illustrations of the proposed building elevations. This slide addresses the conditional use request for the residential care facility, as well as the hours of operation. The proposal requires conditional use approval for the use because residential care facilities are a conditional use in the community service zoning district. A second conditional use permit is required for hours of operation, as the facility is proposed to operate 24 hours a day and 7 days a week. This slide addresses the tree plan 2 application. The applicant proposes to remove 17 community trees. Staff notes that the applicant also proposes to plant 46 new trees with development. And staff further notes that 11 of the community trees that are proposed for removal are located along Evergreen Place, where the applicant proposes to construct a new 10-foot sidewalk with tree wells. Staff recommends that Planning Commission approves CAT Intensive Service Building, subject to the conditions identified in the staff report. And with that, I'm happy to answer any questions that you all might have. Thank you.
Great. Do any commissioners have questions of staff? Commissioner Waller.
Thank you. I was curious about the, well, there's a couple of times when under the both conditional uses where there are findings about residential uses within 500 feet of the property. And I think both cases you cited that the closest residential was across, was it Northwest Cornell or Southwest Cornell? Whatever, Cornell Street. But yet I noticed, I was curious because of the aerial photo. And then when I conducted the site visit, there appears to be residential uses just what would be northeast of the property. So I was wondering why that, why those apparently looks like apartment units weren't characterized as residential in your findings.
That's a very astute observation. Yes, there is residential uses on that site. The important factor here is that those are apartments, but they are not located in a residential zone. So the stipulation there is that the closest residential use in a residential zone is the site that is kind of to the south.
In the Brown area, then that's residential zoning.
Correct.
Okay. All right. Well, thank you for that clarification. And I also had a question about the clients, and I don't know, maybe you'd like the applicant to respond to this, but I was curious whether there would be much pedestrian traffic, and I was considering where the closest transit might be, and I did see a bus on Cornell. So I was just wondering if you considered the pedestrian use of for the clientele of the facility and how they might access transit, assuming they may not all have vehicles.
Yes, the closest, as you stated, the closest transit facility is that bus station on Northwest Cornell Road, and I will leave it to the applicant to further discuss how the folks living at the site will traverse the area.
Okay, fair enough. Thank you very much. That was it.
Okay.
Commissioner McCann.
Yeah, I just had a quick clarification, Erin, on the tree mitigation. So I understand that there's a removal of quite a few trees on site, many of which are large species. And so I read through the note that total mitigation can't it would be very hard, if not impossible, to mitigate for the amount of caliper inch loss on this site. My question is, does the city then require a fee in lieu for the delta, or is the request simply to say that the 46 trees, even though they don't meet the caliper inch requirement, that they would suffice and they would be done? Or do you have to pay into a mitigation?
Good question. You do not have to pay into mitigation. The way that the standard's written is essentially the inch per inch for landscape trees. There actually is no mitigation requirement for community trees. And there is a stipulation in that standard that if you cannot meet the inch per inch DBH, that you demonstrate that you have provided as many trees as you possibly can on the site. And the applicant has provided a supplementary memo from an arborist kind of outlaying their thought process behind the design of the site and the trees that are included therein.
Okay, thank you for the clarification.
You're welcome.
Okay, do other commissioners have questions? Last chance. Okay. Then we can move on to the applicant presentation. The applicant will now have 20 minutes. Please begin by introducing yourselves and stating your name and address for the record.
Hello, I think that's myself and Kristen. My name is Sarah Vaz, and I am with Holst Architecture. And Kristen, would you like to introduce yourself?
Certainly. Good evening, Commissioners. My name is Kristen Burke. I work for Washington County, and my address is 155 North First Avenue, Hillsboro, Oregon, 97124.
And my apologies, I might have missed the address. I'm at 123 Northeast 3rd Avenue with Holst Architecture. I'm going to share my screen here, and Kristen is going to get us started with a little bit of the big picture on our project.
Yes, thank you, Sarah. I'd like to start with just a little bit of information about the services that we're going to provide before Sarah goes into the detail about the architectural plan. The CAT, we call it the CAT, which stands for the Center for Addictions Triage and Treatment. This is a project that we've been working on for some time to bring new treatment infrastructure to residents of Washington County who struggle with problematic substance use. The concept is to really have a program that has multiple levels of care that people can transition to with very rapid access to care, so that we can really get people into treatment as fast as possible and really support their needs. This is planned to be a comprehensive center, like I said, with lots of multiple types of care integrated. It is spread across 2 separate sites. This site will have some of the services. We also have a site in Hillsboro off of Evergreen Parkway, Elam Young Parkway, that will also have other services, but are part of the overall continuum of care. Next slide, please. I'm sure many of you are aware of the struggles that are currently occurring in our community around untreated substance use. The simple fact is that there's a lack of services available in our community. There was a recent study that came out by Portland State University and Oregon Health and Science University that did an analysis about the capacity and the needs of treatment in our community. And what it found is that Washington County currently only has about 25% of the treatment services available to our community members based on the size of our community. So this project is really working to address that lack of infrastructure in our community. We don't have any sobering services in Washington County that are publicly funded. We don't have any withdrawal management, which is also referred to as detox services, that's publicly funded and accessible to our community members, and very few residential beds. And as you all know, these are contributing factors to housing instability, homelessness that we see. And what's happening is that our community members are ending up in systems that weren't designed to support their needs. They're ending up in the jail, they're ending up in emergency rooms. This program is really designed to help people get access to the services they need and free those other services up for what they're really designed to do. We've spent a lot of time working on engaging the community, and I'm going to talk about that in just a minute. But the feedback that we've received is that there is a lot of excitement about this project, and really just a lot of reinforcement about how needed this project is. Next slide, please. So this project is focused on adults who have problem substance use. We're really tailoring the project to support individuals who struggle with access to care. So people who have the least amount of resources available. So in that respect, we're really looking at focusing our support on folks who have Medicaid, who are low income, uninsured. We will serve anybody who wants treatment, and including those with commercial insurance, but it's really intended to be a program to help fill some of the voids in our continuum of care. People will not be turned away based on their ability to pay, and this is a really important piece. The services are voluntary. We will not be serving people who are involuntary at this site or through this program. I know there was a question about transportation to and from the center. How will people access the service? And then also how will they transition when they leave the center? We did select this site because it is proximal to a bus station. However, we expect that most people who come will be brought by loved ones. And then we will also be using medical transportation services and other services such as Uber and cabs to help people get to where they're going after they've completed treatment, or should they decide to leave treatment before treatment is completed. Our goal is to always help people get to wherever is the next safe place for them to be. So it's never our intent that people will be just coming to or walking away from the center on their own accord. We really want to help them get to the center and then help them leave. Next slide, please. So this is a project that's been under development for quite a long time. We started back in July of 2019, and we really just started with the concept of building new infrastructure in our community, but then brought in a lot of people with lived experience, a lot of stakeholders, people in our criminal justice system, people in our treatment system, and people who have been through treatment system to tell us what we needed to create in Washington County. So this is really a program that's designed specifically for the needs of Washington County. You can see all of the different dates there, but what I really want to do is emphasize the amount of community engagement that we focused on throughout this process. We have held multiple community meetings. I have attended 2 of the neighborhood association meetings to talk with people about this project. We've reached out to business owners immediately adjacent to the buildings, both the business owner directly south of us. I've had conversations with him, as well as the apartment manager of those apartments that are north of the building. So we really want to try and focus on being a good neighbor and have this be a real asset for our community. The final thing around community engagement is that we recently held an open house. We had over 50 participants come and tour the site, meet with the staff of Holst and of the county, we had representatives from the Beaverton Police Department there. We have really advertised the open house broadly through social media. We sent out mailers, really inviting in community members to come and learn about the project. And so we had over 50 people arrive, and we really received no opposition in that meeting. And in fact, a lot of excitement and a lot of questions about when it's going to open and how soon we can start providing services. Next slide, please. With this, I'm going to turn it over to Sarah to continue.
Thanks, Kristen. So here we are. This is our existing site. Fronts Northwest Evergreen Place here to the west, and the private street on an easement here to the south. For our purposes, the site is, a little bit angled, so north is towards the right side of the page. The building was used as an emergency dispatch center until recently. The building footprint is approximately 21,000 square feet. And there are three kind of large main asphalt parking areas to the south of that existing building. A lot of the large trees on site are located here to the northeast. And there's some significant mechanical equipment in here in a walled-in parking area. That's kind of what we're looking at as existing. And then this is our proposed site plan. So we're adding a new building, a new two-story building here to the south of the existing building. The footprint is about 7,000 square feet. And we will also be proposing to renovate the existing building significantly on the interior with a reclad of the exterior. We are reducing and reconfiguring the parking areas. We're proposing sidewalk frontage improvements meeting the city standards along both frontages. So here and here, that's the dashed red. We are also proposing on-site walkways connecting the building entrances, and there are three main building entrances. So walkways connecting those and the public sidewalks and the entrances to each other per city standards. We are providing short-term bike parking spaces by the main entry and long-term bike parking spaces by one of the other entries on the inside, so they're covered and protected. And then we, like Aaron was saying, we're adding a number of new trees to the site and making significant landscape changes that include 2 enclosed courtyards between the existing building and the new building. And those will be for patient use, which is why they're enclosed. So here's what the proposal looks like from the air. We've got, here we're hovering kind of towards the southwest of the site above Evergreen Place. And we're looking at the new building, ground up building, 2 stories. And then over here, the reclad existing building. You can kind of start to see a little bit of the courtyards between the two. This is just a quick little diagram to sort of clarify. We're recladding that existing building. This is the new building with a low sloped roof. And we're adding a new vestibule to that existing building and a car cover at our drive-through drop-off. So real quick, here's a first floor plan diagram, kind of outlining how our program lays out inside the building. This, the bulk of that first floor plan is the renovated existing building. And then we have over here that new building. The pink is the residential program, so that's primarily going to be in the new addition with the little breezeway connecting it to the existing building where we'll have our dining spaces and a kitchen also serving that residential program. So those are the folks who are going to be staying for longer term. The blues, these 2 blues, the darker and medium blues, those are the sobering program. Here is the darker, and then the medium blue is the detox program. Those folks will be there for a significantly less amount of time. And then light blue is our lobby and intake spaces. So this is our primary entrance. Folks will come into the lobby and go into intake rooms, exam rooms, etc., and then be routed through the building for their respective programs. Yellow is staff spaces. Gray is back of house support spaces. And then this is our second floor program diagram. You can see there's only a second floor on that new building. The existing building is a single story per level. The second story of the new building will house all of the sleeping rooms for the residential program. And here are our street-facing elevations. So this is the elevation that faces northwest Evergreen Place. We've got that reclad of the existing building with a new vestibule. Between the 2 buildings, you can see our fence enclosing our courtyard. That's for privacy of the patients and their security. The new building over here, new addition, you can see the sloped roofs and the 2 colors of fiber cement cladding to articulate that new mass. And then along the private street to the south, this is the long facade of our new addition with windows, overhanging roof, and an overhanging second floor to break up that facade. And this is that residential program entry. That's kind of a side entry for residential patients only. So this is the view that you'll get as you're walking up that sidewalk along Evergreen, with the new building in the foreground, recladding the existing building behind it back here, a drive-through drop-off over here, and a portion of that existing parking lot that we're keeping over here. And this is a view of our main entry with that new vestibule, the car cover over that drive-through drop-off, and the new addition kind of here in the background. And this is a view of the entry to that new addition. Like I was saying, that's where the residents for the residential program will be coming in and out if and when they need to. So secondary, primarily secondary entrance. And then here's a view of our active courtyard. We've kind of split up our courtyards into an active and quiet side. Our active courtyard provides a space for patients to play some basketball, do an outdoor yoga session, something like that. And here's a view of our quiet side courtyard where patients can get outdoor group therapy session or just have the space to read and meditate and view into our dining spaces here. So that is our proposal. Thank you for listening, and we're happy to take any questions.
Right. Do any commissioners have questions? Commissioner Ellis.
Yeah, great walkthrough. Thank you. The staff report didn't mention any requirements relating to it, but I'm just curious, are you simply inheriting the giant communications tower, or do you have to do anything with that?
We are inheriting it. Yeah, we're rerouting some of their fiber lines, but we're keeping the tower as is. Yeah.
Okay.
Any other questions of the applicant? You might be getting off easy. Okay, I am not seeing any other questions for the applicant, so we can move on to the next portion, which would be the public testimony portion of the agenda. We will call for testimony in groups, starting with those in favor of the application, then those in opposition of the application, followed by those neither in favor nor opposition. As a reminder, testimony is limited to the criteria that apply to the application. So now is the time for those in favor of the application. For those viewing via Zoom webinar, please communicate by using your raised hand feature in the Zoom menu bar. If calling in, press 9 to alert the chair you would like to speak. Do we have anyone wishing to speak this evening? How about anyone wishing to speak in favor or opposed or neither? Still seeing none? Okay. The applicant's really getting off easy tonight. We have no public testimony this evening. Let me just make sure I'm still on track there. So with no public testimony, there is no need for rebuttal this evening, which means we can move right along to staff comments. Any final comments from staff?
No final comments from staff, Chair. Thank you.
Okay. This is going quick tonight. So with that, with final comments complete, we can close the public hearing, and as standard procedure, I will randomly poll commissioners to state their conclusion on the application. I will start with Commissioner Lawler.
Well, I certainly firmly believe that this is a facility that is in grave need of operation in our county. So I think it fills a very great niche. I think it's a good location. I noticed there's, between here and Cornell, to the south, there's a wetland and a little walkway, and so anyway, it's a shopping center. I mean, it's an interesting location. That's why I needed to conduct a site visit. Anyway, I think that given the fact that the clients will generally be shuttled to and from the facility, and there will be a minimum amount of walking down the street, I am less inclined to worry about the frontage between here, the site, and Cornell Street, which is where people would be walking. So with that blathering statement, I believe that the application meets the criteria and should be approved.
Thank you. How about Commissioner Glenn Winkle?
There we go. I agree with Commissioner Lawler. This is a critically needed facility. I do think the location is good. I think it's very well designed. I think the applicant has done a great job with the application. It meets all the approval criteria with the conditions of approval. So I'm in full support.
Great, thank you. And Commissioner Ellis?
Yeah, I think I'm in line with everybody here. It looks like it meets the conditions, and I appreciate the staff report that covered that. I'm sure that the developers are already working on this. I'll be interested to see Evergreen Place there is a common resting place for semis and other kind of transient vehicles. And so seeing how they deal with that over time would be interesting. But yeah, otherwise it looks like it meets the conditions and it's a badly needed service.
Great. And Commissioner McCann?
I'm in agreement with my fellow commissioners, appreciative of the county taking on this much needed facility, and thought the package in the submittal looked great and meets the criteria.
Great. And Commissioner Winter?
I concur with my fellow commissioners.
Okay, as do I. And I appreciate that the community is not opposing it. So with that, do we have a motion?
Sure, I can make a motion. I move to approve application CUN3 2023-00346, CUN3 2023-00347, DR3 2023-00348, TP2 2023-00351 for it's the application for LU3 2023-00356 CAT Intensive Service Building, subject to the conditions of approval in the staff report dated November 22nd, 2023, and direct staff to prepare a final decision and order based on the findings in the staff report and the entire record.
Great, thank you. Do we have a second on the motion?
I'll second.
Great. Commissioner McCann moved and Commissioner Lawler seconded. Any discussion on the motion? Okay, seeing none, I will do a vote by roll call. Commissioner Ellis.
Aye.
Commissioner Glenwinkle.
Aye.
Commissioner Lawler.
Aye.
Commissioner McMahon.
Aye.
Commissioner Winter.
Aye.
And I vote aye as well, so the motion passes unanimously. The Planning Commission's decision will be memorialized in land use orders that will be provided to all parties that provided oral and written testimony. If you would like to appeal this decision, you must appeal in accordance with the applicable provisions of the Beaverton Development Code and rules of the Land Use Board of Appeals. So we are now adjourned at 7:09 p.m. Everyone have a great evening. Thanks.